In the birth of a child, a number of changes occur in the position of the fetal head as it descends through the bony and narrow birth canal. These changes, called the cardinal movements of the labor, they are engagement, descent, flexion, internal rotation, extension, external rotation, and expulsion. The movement applied to the fetus that is presenting in a vertex presentation, an optimal presentation in which the fetal head is fully flexed. This is in contrast to the other cephalic presentations in which the head shows incomplete flexion or even full extension. Engagement occurs when the widest diameter of the fetal presenting part, the head in this case, has passed through the pelvic inlet. Note how the fetal head enters the pelvic inlet, which is widest from side to side. Descent, the next stage, is the progression of the fetal head into the maternal pelvis. The degree of fetal descent is measured by stations. Station referred to the level of presenting part in relation to the maternal ischial spines, which represent the narrowest diameter through which the fetus must pass. If the head is at position 0 or station 0 at the level of the ischial spines, engagement has occurred. Positive number indicates that the presenting part of the fetus has descended past the ischial spines. Flexion occurs as the fetal head descends and comes into contact with the soft tissues of the pelvis, the muscles of the maternal pelvic floor and the cervix. The resistance encountered with these structures causes the fetal chin to flex downwards onto the chest. This position allows the smallest fetal diameter to enter the maternal pelvis. As the fetal head continues to descend, it must rotate to accommodate changes in the width of the pelvic opening. While the pelvic inlet was widest side to side, further down the pelvic cavity is widest front to back. The next stage, extension, is underway. As the fetal head passes under the maternal symphysis pubis, it meets with the resistance from pelvic floor. The head pivots and extends with each maternal pushing effort. The head is born in extension with the face directed towards the rectum. The next stage is external rotation. After the head is delivered in the extended position, it rotates briefly towards the position it occupied earlier in the pelvic inlet, realigning the head with the long axis of the body. This movement is termed as restitution. As restitution continues, the shoulders align in the anteroposterior diameter, causing the head to continue to turn further to one side. The fetal trunk moves through the pelvis with the anterior shoulders descending first. In the next stage, expulsion, maternal pushing efforts bring the anterior shoulder under the symphysis pubis. Lateral flexion of the shoulder and head occurs and the anterior then posterior shoulder appears. Once the shoulders are delivered, the rest of the body quickly follows.